A very good morning, everybody. Today we will be dealing with the anatomy of the front of the leg. So the leg is the region that lies between the knee joint and the ankle joint. There are two important bones here. We have tibia and the fibula, and the tibia and the fibula are joined together to each other by an interosseous membrane. This interosseous membrane binds the two bones together, and it also provides attachment to the neighboring muscles. Talking about the superficial fascia of this region, when we look at the superficial fascia, it contains some veins and some cutaneous nerves. This diagram shows the superficial veins of this region. What are the superficial veins in this region? We have this portion that is known as the dorsal venous arch. The dorsal venous arch is formed by, we have dorsal digital veins. These dorsal digital veins, there are two dorsal digital veins in each toe. Each joins the corresponding dorsal digital vein of the, it joins the corresponding vein of the adjacent toe, and it forms these. These are the dorsal metatarsal veins. These dorsal metatarsal veins go and they terminate in the dorsal digital venous arch. Dorsal venous arch. The dorsal digital vein on the medial side of the great toe, this one, joins the medial end of the venous arch and goes and forms the great saphenous vein. The dorsal digital vein of the lateral side of this little toe joins the lateral end of this dorsal venous arch, and it joins and forms the small saphenous vein. The venous drainage of the lower limb is important, and we will be dealing with it in a separate lecture, that is the venous drainage. But right now you should know what are the superficial veins you see on the dorsal aspect of this leg. So we have a dorsal venous arch, we have dorsal digital veins. The dorsal digital veins, two dorsal digital veins in each toe. The dorsal digital veins of the adjacent toes, they join together, form these. These are the dorsal metatarsal veins. The dorsal digital vein of the medial side of the great toe joins the dorsal venous arch and forms a great saphenous vein, whereas the dorsal digital vein of the lateral side of the little toe goes and joins this dorsal venous arch to form the small saphenous vein. Okay, now let's see the different cutaneous nerves we see in this area. Now, the cutaneous nerves we see in this area are, we have the infrapatellar branch of the saphenous nerve. The infrapatellar branch of the saphenous nerve supplies the skin over the ligamentum patellar. Then we have the saphenous nerve. The saphenous nerve supplies the skin on the medial side of the leg and the medial border of the foot up to the ball of the great toe. Up to the ball of the great toe. Then we have the lateral cutaneous nerve of the calf. The lateral cutaneous nerve of the calf is a branch of the common peroneal nerve, and it supplies the upper 2/3 of the leg laterally. Okay. Then we have the superficial peroneal nerve. The superficial peroneal nerve, it is a branch of the common peroneal nerve. It passes the deep fascia at the junction of upper 2/3 and the lower 1/3 of the lateral side of the neck, and then it divides into lateral and medial branches. It supplies the skin over the lower 1/3 of the leg. The whole of the skin on the dorsum of the foot is supplied by the superficial peroneal nerve, except the cleft between the first and the second toe, that is supplied by the deep peroneal nerve. The lateral surface of the little toe, that is supplied by the sural nerve, and the medial border of the foot up to the ball of the great toe, that is supplied by the saphenous nerve. Okay, so again, to repeat it, we will see that we have an infrapatellar branch of the saphenous nerve. This is supplying the area over the ligamentum patellae. We have the saphenous nerve. The saphenous nerve supplies the skin on the medial side of the leg up to the ball of the great toe. Okay, then we have on the lateral side, we have two halves. The upper 1/3 is supplied with the lateral cutaneous nerve of the calf, whereas the lower part is supplied by the superficial peroneal nerve. This superficial peroneal nerve supplies whole of the lower half of the leg. Then on the dorsum of the foot, it supplies whole of the dorsum of the foot, except the cleft between the first and the second toe. Then the lateral surface of the lateral side of the little toe and the medial surface medial side of the great toe up to the ball of the great toe. Okay. Now, talking about the deep fascia of the leg, the deep fascia, as we have seen deep fascia everywhere in the thigh, the deep fascia encloses the leg. It is very strong and it encloses it like a tight sleeve. Below the condyles, it is attached to the periosteum on the interior and the medial border of the tibia. We have two intermuscular septa, the anterior and the posterior, that extend inwards, and they are attached to the anterior and the posterior border of the, okay, I don't have any diagram for that, anterior and the posterior border of the fibula, and they convert the whole of the leg is divided by the interosseous membrane and these septa into three compartments. We have an anterior compartment, we have a lateral compartment, and we have the posterior compartment. Therefore, the leg will be discussed in anterior compartment of leg, the lateral compartment, and the posterior compartment of the leg. Now, let's talk about the anterior compartment of the leg. There are some muscles which we see in the anterior compartments, the the different vessels, and the different nerves we see here. The main muscle we see is here are the tibialis anterior, the extensor digitorum longus, the peroneus tertius, and the extensor hallucis longus. The artery of the anterior compartment is the anterior tibial artery, and the nerve is the deep peroneal nerve. Okay. We know we have studied the modifications of the deep fascia in our lecture of general anatomy. So, the same way, the deep fascia of the anterior aspect of the leg near the ankle joint, it forms thickening that are known as the reticula. The reticula, and as we know, the reticula, the main function of these reticula is to retain the tendons at any joint. So the reticula at the knee, at the ankle joint, retains the tendons around the ankle in place, and it prevents its bowstringing during movements of the foot. So you can say that the reticula, the deep fascia around the ankle joint is thickened to form strong fibrous bands called the retinaculum, which retain the tendons at the ankle joint in place. We have a superior, the different reticula we see are, we have a superior and inferior extensor retinaculum, which we'll be dealing here today. Superior extensor retinaculum, and we have an inferior extensor retinaculum on the front. Okay. Then on the lateral side of the ankle, we have superior and inferior peroneal retinaculum, and we have a flexor retinaculum on the posterior medial aspect of the ankle. We will be dealing with the superior and the inferior extensor retinaculum, which lie on the front of the ankle. Okay. Now, so this portion is the superior extensor retinaculum. The superior extensor retinaculum, it forms a broad band which is about 1.5 inches wide, and it lies just above the ankle joint के ऊपर lie करता है. When we look at the attachment medially and laterally, what are the attachments? Medially, it is attached to the lower end or lower part of the anterior border of the tibia, and laterally, it is attached to the lower part of the anterior border of the fibula. Okay, tibia के साथ और fibula के साथ. ठीक है. Now, when you look at it, okay. Medially, this splits and it encloses the tibialis anterior tendon with its synovial sheath, whereas the other structures that lie in the anterior compartment, which are the extensor hallucis longus tendon, the deep peroneal nerve, the anterior tibial artery, and the extensor digitorum longus and the peroneus tertius, they pass deep to the extensor retinaculum. Here, the tendons of these muscles are not surrounded by the synovial sheath, and the deep peroneal nerve and the anterior tibial artery lie deep to the tendon of the extensor hallucis longus. Okay, so basically, what you have to remember here is that just above the ankle joint, you have a thickening of the deep fascia that is about 1.5 inches wide, Okay, it is attached medially to the anterior border of tibia, laterally to the anterior border of the fibula. Okay, and then medially it splits and it encloses the tendon of this tibialis anterior muscle, whereas the other components that are present in the anterior compartment lie posterior to it. Okay, then we have the inferior extensor. The inferior extensor retinaculum, when we look at the inferior extensor retinaculum, it is Y-shaped band of deep fascia and it lies just anterior to the ankle joint. The stem of this Y here, it is attached, lies laterally, whereas medially it divides into an upper band and a lower band. This stem of the Y is attached to the anterior non-articular surface of the calcaneum. When you look here, it will become more clear when we will be studying the calcaneum. And this is the calcaneum, that is the heel bone. Okay, so the stem of the Y is attached to the upper surface of the calcaneum, where upper surface of the calcaneum that lies anterior to the sulcus calcanei here. The upper band of the Y passes upwards and medially to be attached to the anterior surface. Here you can see. So the upper band of the Y passes upwards and medially to be attached to the upper border of, it goes and it's attached to the upper anterior border of the medial malleolus, whereas the lower border passes downwards and it fuses with the deep fascia of the sole of the foot. So the stem of the Y is attached to the calcaneum, the non-articular part of the calcaneum. The upper band is attached to the medial malleolus, whereas the lower band goes and it fuses with the deep fascia of the sole. Okay. Now, this is the question that is asked in your exams, that are the structures that pass interior to the extensor retinaculum. So there are few structures that cross the extensor retinaculum superficially. From medial to lateral side, we have the saphenous nerve and the great saphenous vein, and we have the superficial peroneal nerve. The structures that lie deep to the superior and the inferior extensor retinaculum, from medial to lateral side, we have the tendon of the tibialis anterior muscle, this one. Then we have this tendon, that is the extensor hallucis longus. Then we have the anterior tibial artery and the anterior tibial nerve, or the deep peroneal nerve. We have the extensor digitorum longus, and we have this muscle, that is the peroneus tertius muscle. Okay, so you can see here, this is the superior extensor retinaculum, this is the inferior extensor retinaculum. This is an easy diagram. You can see here we have the tibialis anterior structures that passes deep to it. We have the tibialis anterior muscle, we have the extensor hallucis longus, then we have the artery and the nerve, extensor digitorum longus, and we have the peroneus tertius muscle. What are the functions of this? As we have already said, that the main function is that it keeps the structures of the interior compartment of the leg in position, and it prevents the bowstringing of these muscles, the tendons, and all the extensor muscles are enclosed in the synovial sheath as they pass through the reticula. Now, the muscles of the interior compartment. All the muscles of the interior compartment of the leg, these are pinnate muscles. The tendon of each muscle passes distally and is attached, it crosses the front of the ankle joint and is attached to the dorsum of the foot. Okay, and all of these are supplied by the deep peroneal nerve. So the muscles of the interior compartment, there are 4 muscles of the interior compartment. कौन-कौन से? Tibialis anterior extend, जो हम लोगों ने यहाँ से पास करते हुए देखे, एक tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tertius. ये सारे muscles pinnate muscles हैं. ये सारे muscles distally जाते हैं और कहाँ जाके लगते हैं? क्रॉस करते हैं ankle joint को और जाके foot के dorsum पे लगते हैं. ठीक है? And सब supplied होते हैं deep peroneal nerve से. So you can see this. This is the tibia. This one is the tibialis anterior muscle. This one is the extensor hallucis longus muscle. This is the extensor digitorum longus. And we have the peroneus tertius hair, the smaller muscle. Now, talking about the tibialis anterior muscle. So the tibialis anterior muscle, when we look at this muscle, it is a multipinnate muscle and it is the most medial and superficial dorsiflexor of the foot. This is the most superficial muscle and it's a multipinnate muscle. Okay. Now, origin and insertion, you can know the origin. It arises from the upper 2/3 of the lateral surface of the tibia. It arises from the adjoining surface of the interosseous membrane and the distal part of the lateral condyle of the tibia. Okay, so origin is from the upper 2/3 of the lateral surface of the tibia, the lateral condyle of the tibia, and the adjoining part of the interosseous membrane. Here. It passes medially and it is inserted on the inferomedial side of the base of the first metatarsal bone and adjacent part of the medial cuneiform. So medially जाता है, यहाँ पे हमारी medial cuneiform होती है और हमारी first metatarsal bone होती है. So it is attached to the inferomedial part of the base of the first metatarsal bone and the medial cuneiform. Okay. Now, supplied by the deep peroneal nerve. What are the functions of this muscle? It is the dorsiflexor of the ankle joint. Plantar flexion हुआ पैर को नीचे की तरफ flex करना. Dorsiflexion हुआ जब हम लोग angle between the ankle joint and the front of the tibia को कम करेंगे. So that is dorsiflexion. Okay. So dorsiflexor of the ankle joint, it inverts the foot. It maintains the medial longitudinal arch of the foot. Okay. Then we have another muscle that is the extensor hallucis longus. The extensor hallucis longus muscle, it arises from the middle 2/4 of the medial surface of the shaft of fibula. So shaft of fibula को हम 4 parts में divide करते हैं, middle 2/4 से, ठीक है? So middle 2/4 of the medial surface of the shaft of the fibula and adjacent part of the interosseous membrane. ये जाता है and it is inserted into the base of the distal phalanx of the great toe, क्योंकि ये hallucis longus है, ठीक है? So ये जाके great toe पे ही जाएगा. So tibialis anterior जा रहा था और first metatarsal के base पे लगता था और medial cuneiform पे लगता था, और ये जो है जो हमारा extensor hallucis longus है, ये जाता है और base of the distal phalanx of the great toe पे लगता है. ठीक, इसका काम क्या होता है? Obviously फ्रंट में जितने हैं वो हमारे extensors हैं. So extension of the phalanx of the big toe and it is a dorsiflexor of the foot as well. Then talking about the extensor digitorum longus. जैसे कि ये मसल जा रहा था, ये base of the distal phalanx of great toe पे जा रहा था. For instance, हम लोगों ने we have seen in the upper limb. For the pollicis, we have a different muscle, right? The same way, here we have a different muscle different extensor for the hallucis and different muscle that will go to the rest of these bones. Okay, so extensor digitorum longus, it arises from whole of the upper 1/4 and medial part of the middle 2/4 of the anterior surface of the fibula. So whole of the upper 1/4, और इसको हम कैसे डिवाइड करते हैं वो हम लोगों ने बोन में देखा है कि हम इसको डिवाइड करते हैं 2 पार्ट्स में. So middle 2/4 of the anterior surface of the tibia से आता है, of the fibula. So lower 1/4 of the medial surface of the fibula and adjacent part of I'm so sorry. So it arises from the lateral condyle of the tibia, upper 3/4 of the medial surface of the tibia, and adjoining part of the interosseous membrane. This one. It goes and it is attached to the middle and the distal phalanx of the lateral 4 toes by the tendons. So it is attached here to the middle. You can see here the middle and the distal phalanx of the lateral foretoes. It is dorsiflexor of the foot, dorsiflexes the foot, and obviously it will cause an extension at the metacarpophalangeal joint, at the proximal interphalangeal joint, and the distal interphalangeal joint as well. Then we have the peroneus tertius muscle. This peroneus tertius muscle is a smaller muscle that arises from the lower 1/4 of the medial surface of the fibula and the part of the interosseous membrane. It is attached to the dorsal surface of the base of the fifth metatarsal bone. It is also dorsiflexor of the foot, and it causes eversion of the foot. To revise it again, we see that we have 4 muscles here. All of the 4 muscles we see here are pinnate muscle. They cross the ankle joint and are attached to the dorsum of the foot. They cause dorsiflexion of the foot, and all of these are supplied by the deep peroneal nerve. We have the tibialis anterior muscle. We have the extensor hallucis longus muscle. We have the extensor digitorum longus, and we have the peroneus tertius. When we look at the tibialis anterior muscle, this is a multipinnate muscle. Okay, it is the main dorsiflexor of the foot. It arises from the upper 2/3 of the lateral surface of the tibia and the lateral tibial condyle and adjacent interosseous membrane. It goes and it is attached to the medial cuneiform and the adjoining part of the base of the first metatarsal bone. It causes dorsiflexion, it causes inversion of the foot, and it maintains the medial longitudinal arch of the foot. The extensor hallucis longus muscle, it arises from the middle 2/4 of the medial surface of the shaft of the fibula and the adjoining part of the interosseous membrane, and it is attached to the base of the distal phalanx of the great toe. Then we talked about the extensor digitorum longus. This one, the extensor digitorum longus muscle arises from the lateral condyle of the tibia. It arises from the upper 3/4 of the medial surface of the tibia, all of this, and it arises from the interosseous membrane. It goes and it is inserted into the base of the middle and the distal phalanx of the lateral foretoes. It will cause dorsiflexion of the foot. It will cause extension of the metacarpophalangeal joints. It will cause extension of the proximal interphalangeal joint, and it will cause extension at the distal interphalangeal joint. Then we have peroneus tertius muscle. The peroneus tertius muscle, it arises from the lower 1/4 of the anterior surface of the fibula and the adjoining interosseous membrane. It is inserted onto the dorsal surface of the base of the fifth metatarsal bone. It causes dorsiflexion of the foot and eversion of the foot. So here in this diagram, we have removed the tibialis anterior muscle. This is showing the origin of the tibialis anterior muscle. Here you can see the extensor hallucis longus, and you can see the extensor digitorum longus, which has been cut, and we have a smaller peroneus tertius here. We have a condition, clinical condition, that is known as anterior tibial compartment syndrome or shin split syndrome or Fresher syndrome. What happens here is that due to overexertion of the muscles of the anterior compartment, especially when the untrained person who leads a sedentary life are asked to walk or run long distances, this compartment syndrome occurs. Muscles of the compartment, they swell within a tight compartment due to sudden overuse, जिसकी वजह से venous return जो होता है वो कम हो जाता है and more fluid fills inside the compartment. The pressure tends to compress the anterior tibial artery and reduces the blood supply to the muscle, which leads to ischemia of these muscles. It is frequently seen in Fresher men.